In today's video, you'll learn about why patient encounter tracking is such an important part of medical education and the best practices in live and simulated patient tracking. Let's talk about holistic success. Hi everyone, I'm Kelly Dore. With me today is Meegan Carlson, who is part of Acuity Insight leadership team. Welcome, Meegan.
Thanks, Kelly. Happy to be here.
Well, I'm excited to talk about patient encounters today. This is something I've had a lot of discussions about in my professional life, so let's get started.
Excellent.
Meegan, why is patient encounter tracking important in medical education?
This is such a great question. Part of any student, resident, fellow, whoever you're teaching, their clinical experience is keeping track of the types of patients they see, the procedures they perform, or the kind of patient encounters that they're having. It helps to make sure that all of your learners, whoever they may be, have the opportunity to see patients with specific diagnoses or procedures that are the requirements or the objectives of training. It's also really important to note that for a lot of programs, especially in medical school, it's an accreditation requirement to have a system in place to monitor and track what your students are experiencing and helping to make sure you can fill in those gaps if they have any in what they're not able to see.
Amazing. Now, Meegan, you began your career in the Department of Medicine at Dalhousie University's Medical School. And after that, I know you've spent many years leading customer success at 145, interacting with, I think, hundreds of medical programs. You've probably learned a lot in that time. Maybe you could share with us some of the key differences because, we talk about patient encounter tracking, but there's live patient tracking, there's simulated patient tracking. What are the differences there?
Yeah, it's a great question. I wouldn't say that there's a difference in the tracking of encounters for patients, whether they're live or simulated. Ideally, the system that your students or residents are using to track experiences is going to be the same, whether it's a live patient, a standardized patient, or a simulation. But what's really important is that the program or the student who's doing the tracking themselves is going to have the ability to confirm what have they seen? When have they seen it? Was it on a live patient or was it on a simulation? It's that critical distinction to make sure anybody who's tracking the encounters or procedures, they can easily figure out whether it was a simulated experience or something in a clinical setting with a real live patient.
I would imagine that information is not just useful for the learner, but also the program too, in understanding, what kind of patient experiences they're able to offer, maybe where some gaps are.
Absolutely. Especially in where their students are seeing these procedures or encounters. Things like if they're on their emergency medicine rotation, are they seeing the procedures that we'd expect or that we need them to see to meet the objectives of the program? A program needs to know that kind of information. And if they're not, well, how can they make sure they meet them? And that's where simulations can come in and help fill some of the gaps.
Can you share some of the best practices for live and simulated patient encounter tracking? And how should this data be collected? Does it differ by method, or what are some things that programs should think about?
Oh, this is great. I wish more programs asked this question as they were evaluating systems. When it comes to the differences in reporting, I think it's so important for programs to make sure they're not just looking at the types of patients or the clinical skills, but also the clinical setting and the levels of responsibility that the learner might be taking. For example, when we work with schools here at Acuity, we break down a lot of our logs by participation level or by the patient type alongside the setting. Let me give you an example. Let's say you have a patient with abdominal pain. And the program objectives requires that every time a learner comes through the program and they see a patient with abdominal pain, they have to see that type of patient at least twice during their training. You could require them to see at least one of those on a live patient, and then the other could be made up on a simulation. But you would also want to be able to confirm, did they observe the encounter, watch somebody else do a procedure or a history and physical? Did they actively participate in the encounter, or did they independently perform that history and physical all on their own with that abdominal pain patient? So it's really important for a program to think about what are the competencies they are requiring for each type of encounter, and then develop over time how do they incorporate that into the structure so they're getting what they need out of the system.
Meegan, you hit the word I was thinking about. I was thinking about competencies as we talk about this, because as schools either move to or think about or are already in, whether it's competency-based education or EPAs that they're thinking about, that's another level of information they have to process. And so having all of the encounters tracked and organized would likely be, a time savings for them, and a way to actually better manage their information. Now, knowing that it might be helpful, what are maybe some of the barriers to adopting these best practices?
Mm-hmm. I like to think about this in questions. Let's say your learner experiences, they have to scroll this giant list to find the diagnosis or the procedure they're trying to track. Or does their log end up telling them in the end that they've met requirements for a specific procedure? You need 4 of these, you had 3. And then at what level of competency they need to perform it. The challenge is often how a program will look at setting up the system to benefit their learners. I've seen forms that are ridiculously complicated. They take the student a really long time to fill in all the mandatory fields. It really doesn't help the experience that your student or your resident is having. You want to find something that's a bit intuitive. It's not too long. There's a balance between the complexity to fill in, but it's organized. So you're collecting the information that helps your learner stay on track, meet your program objectives, and see where and when those procedures are happening. And finally, make sure the program's meeting all of those requirements so you can check that accreditation box.
Amazing. So, based on all of your experiences talking to so many programs, as well as managing, your own personal experiences at a med school, what are 3 takeaways you'd recommend for patient encounter or procedure tracking for programs?
Okay, number 1, always frame around your program objectives and competencies. You're setting it for a reason. You want your learners to have that experience and to make sure they're coming out of their direct observation and clinical skills with those competencies in mind. And then use that to set the expectations on your logging system that you're using. If it's just about counting exposure to a criteria threshold, that makes your system selection easy. But if it's also about ensuring settings and offerings around the expected encounters are clear, that experience for your learner and meeting those objectives gets so much easier. The second one would be think about how feedback is going to be incorporated. Of course, your faculty and senior residents need to be enabled to provide feedback, but also how is that feedback collected and shared with your trainees? Are you capturing it in the tool, or do you need to capture that externally somehow? Really important questions that sometimes get overlooked. And then lastly, make sure the tool that you're using to capture all of this information, encounters, procedures, that it's focused on your learner's experience. If you make something too complicated, it means the quality of your data and even the experiences they have won't have the same impact. Even when working for a software company, it's not about the system, it's about the people who have to use it.
Couldn't agree more, Meegan. Couldn't agree more. This has been so much fun. Thank you for joining us today and for sharing all of your thoughts and your experiences with us. To all of you, thank you for watching and listening. If you haven't already subscribed to the show, please do so now. And also, don't be shy to share this information with a colleague, share this episode who may benefit from all the experience Meegan has had. And with that, we'll catch you at the next episode. If you enjoyed this episode of our show, please be sure to check out the other episodes. And don't forget to subscribe. We have a new episode releasing every week.